Cholecystitis is inflammation of the gallbladder and can be acute or chronic. It could also be with or without gallstones.
Risk factors include being a woman who's under the age of 60, or if you're a man or a woman and you're over the age of 60, your risk increases. Anybody with a family history of gallbladder issues is at a higher risk, as well as being overweight or having rapid weight loss. If you eat a diet that's high in fat or cholesterol, or if your diet's low in fiber, your risk for cholecystitis increases. American Indians and Mexican Americans experience a higher occurrence of cholecystitis. People who take statins or on drugs like birth control or hormone replacement therapy, people who have diabetes or a history of liver disease are also at higher risk.
The clinical presentation is right upper quadrant pain that comes and goes, especially after eating fatty foods. Fever, chills, nausea, and vomiting. Feeling full, jaundice, dark urine, clay-colored stools are also common. People who have bilateral carpal tunnel is an indication of systemic origin, or having asteristics. Elderly may have no pain or fever, but they might instead be confused or shaky.
As a PT, a thorough but efficient evaluation is key. Somebody comes in complaining of right shoulder pain or right scapular or between the scapulas, especially if it's accompanied by right upper quadrant pain. It's important to ask questions about GI symptoms, bowel and bladder changes, and what makes their pain worse. If you suspect that the gallbladder is the origin of their pain, the Murphy sign is a great tool you can use to decide if a referral is necessary. When referred, ultrasound is usually the diagnostic tool used by the physician.
Laparoscopic cholecystectomy is the gold standard for treatment, and PTs, when they receive these patients post-op, usually focus on maintaining respiratory function, pain management, compression, and lower extremity exercise.
Prognosis is good for patients who have cholecystitis, both acute and chronic, as long as medical treatment is sought early. So be sure to ask proper follow-up questions for patients who present with these signs and symptoms.
Thank you.